Welcome to another exciting episode of the Injury Report. I'm Steve Politziner from ESPN West Palm, and of course with me today, our esteemed host, our medical expert, and the man who brings some of the most intriguing guests to the show from South Florida Foot and Ankle Center's Dr. John Cutler. Hey, John.
Hey, Steve. Great to be here. It's we had a lot of good doctors that we bring in before, great doctors, I should say, and now the doctors seem to talk about how to get these athletes better quicker. What do we do to get them better? Rehab, surgery, but they all seem to mention PRP, and it's just 3 letters of the alphabet that we really don't know what it means. So doctors don't know what it means. In fact, I can remember listening to the doctor's radio show, we talk about that on XM, where the orthopedic department says, we're not ready to use PRP 2 years ago. Now I listen to that show, and the same show says, of course you should use PRP before you do any surgery. So I thought it'd be really interesting to bring Steve White here, who is a president of his own company, which they go out and they get the PRP for the doctors. And as we're going to learn today, I think from Steve, the PRP is not the same, meaning that some doctors use one brand versus another, and some results are different depending on what PRP you use from what company. So I want to welcome Steve White here today, who is from Jupiter, Florida, and president of a company which only does biologic materials for the different places of the body that orthopedics work with, and what other various doctors use PRP or different type of stem cells.
Well, first of all, thank you both for allowing me to be here at this ESPN headquarters, and I'm excited to talk and help educate the masses about the fact that not all PRP is created equal. To answer your question, we literally have the ability to handle many different specialties, from oral surgery to orthopedics to cosmetics. PRP is something that can heal everyone, young and old, and platelet-rich plasma actually goes back to World War II, so they've been playing with this for quite some time. It's just been in the last few years that they've been able to fine-tune it and really deliver a product that can be consistent and reliable, so each patient gets the best, most optimal product.
Wow, interesting. Right off the bat, and I think there's so many different ways we can go on this, Steve. Let's just start a little bit about what does it mean. We hear platelet-rich plasma. That's something that these athletes fly to Germany for. What does blood spinning have to do with this? I mean, really give us kind of a 101 for the layman about what this new and emerging technology is.
Sure. Platelet-rich plasma is exactly what it sounds like. It's plasma that is rich with platelets. There's a right way to do this and a wrong way to do this, and there's 2 types of PRP that I've kind of categorized it as a low concentration PRP and a high concentration PRP. To get a little bit more scientific, the American Academy of Blood Banking has identified platelet-rich plasma to be a product that consists of 600,000 platelets or more per cubic microliter. And to fit into that guideline, you have to have specialized equipment that can be used during a blood draw, and you spin it down in a centrifuge that delivers that threshold of high concentration platelets.
Now, why are high concentration platelets better?
High concentration of platelets are better because research has shown angiogenesis is observed, which is the basics of healing, when you reach a level of about 1 million plus platelets per cubic microliter.
Angiogenesis, Steve, for the people like me, maybe, or Steve. Angiogenesis, what are we talking about?
Basically, we're talking about your ability to heal yourself and to create the opportunity or environment with fresh, healthy blood and the elements that help with everything from a skinned knee to a broken arm. And we want to make sure that we can go ahead and deliver that. Platelets are critical to every level of healing. And in order to get to that angiogenesis, an accelerated matter, we see that you need about 1 million platelets per cubic microliter, and this was backed up by studies done by notable people multiple different times.
And is the best way for those platelets to enter the body in conjunction with blood versus a shot in your arm, a pill, an IV, something like that?
Depends on the injury. Sometimes you can just do a topical application, for example, a diabetic wound. A lot of times you need to get in deep for a tendon or a ligament, so you need an injection. And the PRP is delivered in a small volume of plasma, so the platelets then carry to that wounded site and release growth factors. the growth factors are what's going to really truly heal you. And the growth factors have protein signals in them that call on the rest of the body to continue this healing process over 3 to 4 weeks, sometimes up to 6 weeks, is when you really start to see a result from this.
Now this-
So you inject the platelets.
Absolutely.
And it's not really the platelets doing the healing, it's the platelets releasing the growth factors, which start a whole system in your body
Right.
to bring all those healing cells into that specific area.
Correct. And essentially, when the platelets release the growth factors then do their job of repairing tissue and bone. And when they're expired, they release protein signals to call on the rest of the body to send more platelets and stem cells and accelerate that healing over time.
Now, sounds great, sounds perfect. Well, why do you hear that the athletes had to fly overseas, and how common is it in the U.S.? Explain
Sure.
there why, I'm just not going to my doctor and saying, hey, you know what, I could use some extra platelets. Let's get
Sure.
my growth factor up.
Well, typically, as we mentioned at the very beginning, Steve, not all PRP is created equal. And everybody has their own kind of cocktail or way in which ingredients that they can go ahead and create the PRP. The athletes that are going overseas are looking to do a little bit different type of a PRP injection, and what they do over there is what would be considered here as more than manipulated. So what they're getting overseas is what we can't offer here according to the FDA guidelines. It's not necessary, in my opinion, to do that. There's plenty of very good doctors here in the United States that can treat these pro athletes that are seeking that type of treatment.
But the FDA just isn't comfortable with the way that is it a governance issue that people are cocktailing without maybe all using the same ingredients, so to speak?
Right, because there's no standard definition and no standard protocol, everybody can kind of create their own ability to do this. So the FDA is trying to kind of standardize this and make this in a way in which, in my opinion, the general public can get the same treatment.
And how far away are we from that? I mean, you're working with local doctors that are
We're
doing
working with local
PRP. So
doctors.
how does that happen if the FDA, standards haven't been fully implemented?
Well, the FDA just needs to control what they are offering, and that is to control medicine so everybody gets something from this. I believe that PRP needs to be a product that is a consistent and reliable product for everyone that's using it. And there's no clinical scientific studies that says one is better than the other.
Oh, so they're more going overseas because maybe there's certain doctors there that are more proven to have the success than it is that it's illegal or that it's...
It's not illegal.
Okay.
They're going
You're right.
overseas because there's a different technique that's being done, and they're avoiding any sort of issue with regards to has HGH been added or any of these other issues that these athletes, steroid issues or what have you, that they have. So they go over there to avoid all that, and they try to get this done.
Yet now it's starting to become more commonplace here.
It's becoming very commonplace here. There's a lot of ways to manipulate blood, and what they're doing overseas is introducing a glass bead technique that acts as an antagonist, which has a different effect on the platelets and the products in which they deliver.
Interesting. We're getting a lot of whole education here today, John.
I mean, today I think we're really going to learn. I mean, this is brand new, not only for the layman, but for also the physicians as well. So I think it's interesting. It's the start of what's going on in the future. One of the questions I'm going to have for Steve, but as medicine goes right now, we're going in a general medical care or a medical community where the patient's paying for more and more of their goods.
They do.
So it's not unusual at this point that people are paying for PRP. But with your experience, I mean, is this ever going to be covered by insurance?
I think down the road when they have some clinical trials that have been proven to show that, if you follow this standard protocol and you use this type of equipment to acquire the PRP and it becomes standardized across the board, yes, I do see that happening. All we're
But are we
doing,
talking 5 years or 20?
it's anyone's guess. It kind of depends on the doctors like Dr. Cutler here, when his group of fellow colleagues really put the studies out there and make it happen. What we're doing is we're making the patient's ability to heal themselves, we're just taking that and increasing it and trying to help them accelerate their healing faster.
So let's go to a couple things. I think we have a good understanding of what PRP is and how it works. What are some of the more common injuries that people are going to their doctor for the PRP therapy?
Great question. I get that on a regular basis. It's the simple injuries that are agonizing and have stuck around for quite some time. You know, tennis elbow is a big one where, you know, they've tried the conservative treatments of cortisone injections, things like that, and it just is a nagging problem that, you know, hey, look, I'm looking for something to solve this problem. Plantar fasciitis, jumper's knee, Achilles tendonitis, those types of things, any sort of tendinopathy or early on stages of osteoarthritis. All of those types of injuries are nagging, persistent pain that, you know, tends to bother people on a daily basis, and they're looking for a solution. And sometimes the standard conservative treatment is not the solution. And we can take their platelets, concentrate them down, and deliver a high concentration of their own ability to heal themselves and make a difference.
So if I have a foot injury and I go to Dr. Cutler and I say, you know, my Achilles has really been bothering me, or plantar fasciitis, how commonplace now is it for a doctor to say, well, you know, there's a few treatments we can consider, one of them is PRP?
Sure. It's starting to become very common, and I think that for an educated patient, the question would be, if you're going to provide me with PRP, what type of PRP do you offer in this practice? And I know that plantar fasciitis, tennis elbow, those types of tendon and ligament type injuries, we've had great success with that. And, you know, that's what a lot of these athletes are looking for. You know, they suffer every day aches and pains and bruises, and this has really enabled them to get to the next level. And it's just as good for the athletes as it is for the common man.
And about the average person who comes in, they get their blood drawn.
They do.
And how long does it take to develop that PRP after that blood is drawn?
Sure. What we do is we draw a small volume of blood. We can draw as little as 30 milliliters, as much as 60 or 120 milliliters, depending on how much volume the doctor requires. So we can fine-tune for the patient specifically what volume they need for PRP. Once we draw the blood, we spin it down in a centrifuge for about 10 minutes. And when we have it spun down, we then have a collection of concentrated platelets, growth factors, stem cell markers that is good for up to 8 hours. So the doctor has the freedom to utilize this technology at point of care.
And so the person who has that tennis elbow or that knee injury or that Achilles tendon or that plantar fascia we talked about, after the injection, is that person immobilized for any period of time to allow that PRP to work inside that tissue, or are they free to go back to activities right away?
Most of them are free to go back to activities right away, depending on the injury. Of course, to tolerance. You know, you don't want to sit there and get an Achilles tendon injected and then go jog 10 miles. I mean, let's use some common sense here. But the reality is there shouldn't be much interruption of your normal routine. If it hurts, don't do it.
Steve White with us, the president of Accelerated Biologics. Really interesting topic today. We're talking about PRP, platelet-rich plasma, and we'll get into the bone marrow stem cells in a bit as well. To follow up on John's question, when do you start to feel better? Like, is it an immediate feeling, the difference, or does it vary? Is there kind of one general indicator that
Sure.
things are moving in the right direction?
Well, that's a great question, Steve. Most doctors will usually treat with an anesthetic, and they'll go ahead and treat the area first so they can then apply the PRP directly to the site. The patients will have some discomfort. It's like a roller coaster effect. It'll come in waves, but that's a response from the biologics that have been introduced to that wounded area. So they can expect to see some discomfort. I wouldn't call it pain, for up to 2 to 3 days, maybe 72 hours at the most. And then you'll see a good response to the healing within 3 to 4 weeks.
Amazing. Yeah, really interesting. And how quick can this thing blow up? I mean, what are the negatives? What are the things that are holding it back? Cost. Awareness?
Cost, awareness, and, you know, the fact that not all PRP is created equal. And there's some clinicians out there who are utilizing less expensive modalities and equipment to acquire the PRP, and not really getting a great clinical benefit. So sometimes the patients out there, they've had a bad taste with this and say, you know, this just didn't work.
And it was this was more than a copay. It cost me a couple of bucks, and
Yeah.
I just didn't see the results. Now, when you say, not all are created equal, are there any that can be dangerous for your body for any reason?
Nope,
Okay.
it's your own ability to heal yourself, so nothing's dangerous. You're not gonna have any problem with that. It's just, did it work or didn't it?
Yeah.
And of the systems that we see where the patients say there's no benefit to this, we can pretty much identify that they had a low concentration.
And when you mentioned about the athletes and the HGH and the steroids, I think there's some perceive, oh, well, they spin the blood and they drop in the steroids and they mix it all up and they stick it back in your knee. I mean, how accurate is that as something that can that actually physically even occur?
The doctors that work with these pro athletes know the restrictions they're under and absolutely do not do that. Absolutely no way. And for the general people, you can utilize those technologies, but there's no doctors that are doing that I'm aware of.
Okay. All right. Well, should we move over to stem cell?
I think PRP is, it's an interesting topic. I mean, the body.
How will you use it, John?
Great
I mean,
question.
you're a podiatrist, you're
Sure.
a doctor, you have hundreds of people come through your offices, you have a lot of different alternatives, you've been treating people 25, 30 years one particular way. Where does this start to come into play for you? If someone's listening right now, and they're thinking, hey, I need to go see the doctor, is this something I should ask about?
So, in my opinion, where this fits into my practice specifically, is people come in with injuries, and we still try to treat with, you treat two ways. One, you want to get the patient better medically first, but two, you still have a responsibility on a financial basis to do the right thing for that patient. So I think you still use the standard care of, let's say it's a plantar fasciitis, a heel pain, where you'll try changing their shoe wear, their shoe gear, orthotics, cortisone injections, therapy, all those things. And when you get to the point where something is not working, then you offer them the PRP prior to any surgery or long-term casting. Meaning we have so many, obviously there's so many tendons going into the foot and the ankle that they get ruptured quite frequently, especially in the older population. And it's a debilitating type injury where it requires fusions should these tendons not heal. So the PRP has a ability to hopefully allow these tendons to heal in a better, quicker response than the traditional treatment, and hopefully avoid some surgery for these people.
Steve, how is this different from bone marrow stem cells, and where does that factor into the PRP world?
Bone marrow stem cells are kind of like the jet fuel for the body's healing capabilities. If you have tried standard PRP treatments and you haven't had great success, maybe there's some issues with the patient's response to the treatment, and the doctor's looking for something a little bit more advanced, we can go directly to the iliac crest and aspirate bone marrow. Instead of the bone marrow, you've got stem cells, and we can directly inject those stem cells right to that wounded area in an effort to try to go ahead and really truly jumpstart that healing process.
So it's like a more advanced, like a PRP plus?
It's a heavier dose.
Would you ever use that primarily before you use the PRP?
No, I see most clinicians actually utilizing the PRP first because a lot of times we can heal patients with one injection of PRP and it's a simple blood draw. We're not tapping the iliac crest and aspirating bone marrow from their hip, which is a little bit more invasive.
But Steve, listen to this. I mean,
So you need to take the bone marrow out and then you put it back in?
Correct.
So like the PRP, and the technology allows the platelets to enhance, which in turn puts the growth factors back in your body.
Right. We're trying to deliver about a total of 1 billion nucleated cells into that wounded area.
And it's a different machine?
Same machine.
Bone marrow? Okay.
Different kits because you have to accommodate for the aspiration of the bone marrow.
And is cost something we can divulge? Is that something that we can talk about where these are right now? I
Sure.
mean, for procedures to be done at your local doctor's office?
It's more involved for the bone marrow, but generally speaking, for a standard PRP injection like Dr. Cutler had suggested for plantar fascia, I see anywhere between $750 and $1,200
Okay.
per injection. And then the stem cell stuff anywhere from $3,000 to $7,500 or more.
All right, and that's why you say, hey, I'll try other avenues first, but if I can't heal them that way from a financial standpoint, this is definitely something to consider.
and one of the things that's exciting, and maybe Steve, you can explain in a little bit more detail. The stem cells. We're gonna introduce the stem cells into, let's say, the knee joint where we have damaged cartilage.
Sure.
Are they going to repair that knee joint with hyaline cartilage, fiber cartilage? How does that work?
Well, everybody responds a little bit differently, and the hope is that you're going to go ahead and repair it with hyaline cartilage. There was an equine study done at Cornell University that they were able to show the use of bone marrow aspirate in a concentrated manner actually regrew hyaline cartilage. And there's no reason to think that if it works in, a horse model, it wouldn't work with humans. We're looking to achieve about an 85% success rate, and when a doctor can go ahead and deliver that type of a biologic to the patient, well, everybody wins.
That's what that means, Steve, is that, arthritis, which is something that we usually say, hey, once you get arthritis, that's it, babe. Here's an opportunity where you catch arthritis early, and if, we can get success with these stem cells, I mean, it's a life changer. It's a life changer right there.
Yeah, it sounds like it. Now, what else do you need to happen for this to really break through? You already have, Tiger Woods and Kobe Bryant's names attached to, PRP treatments, Dwayne Wade. Do you need them to do this in the U.S.? Is that on a more regular basis? Would that be a tipping point to get PRP and bone marrow stem cells treatments off the ground more in the U.S. as a commonplace thing?
They're doing this in the U.S. every day, and they started doing this in the U.S. A lot more than they have in other European countries or South America.
But yet the big names aren't doing it as much in the U.S.
The big athletes?
Yeah.
You'd be surprised.
Okay, so the more and more of them are.
More and more are realizing they can stay home and
Great.
and be treated and recoup in their own house. In my opinion, I believe that the doctors need to offer it to the patients, and many times they just don't. And the patients
not on their radar enough, and the cost factor.
It's an out-of-pocket expense,
Mhm.
and a lot of times the doctor's like, you know what, I'm just going to go ahead and try this. If it doesn't work, we'll go to the OR and we'll cut it out. So
You get a busy office.
Yeah.
You have a busy office, 80 people walking through the office. This is an explanation which is going to take you 25 minutes.
But if it works for everybody, if this thing has 100% or 90+%, rate of success, then you're going to be mentioning it a lot more.
100, no doubt,
Right?
no doubt.
So as the data and time continues to
Right.
support it.
And experience.
Now, but you also mentioned we started, Steve's talking about not all PRP is created equal. What can I do as a customer, as a patient, to find out? What do I ask my doctor? What brand of PRP do you have? Oh, accelerated, they're good. What does the average person do to make sure?
Well, education is great, and the internet has been huge because it really has been something that, the standard patient can go to and arm themselves prior to going to the doctor's office. I think it would be a great question to ask the clinician, hey, if we're going to utilize biologics, preferably PRP, is this a high concentration or low concentration system? Do you even know? And, the doctor should be able to say, what we utilize is a high concentration system that can deliver 1 million plus platelets per cubic microliter. And if they can't answer that question, you need to look into that a little bit deeper.
Right. Well, really fascinating stuff today, John. I think that it sounds like we're learning about a procedure that is going to become very commonplace over time with more experience, and as they can either incorporate insurance or drive the cost down.
And I think we're going to need to have Steve back here
Yeah.
to help. This is not a 45-minute discussion. This is going to be a new way for orthopedists and various other doctors to treat their patients in the future and hopefully avoid a lot of the surgery. And today, Steve, that's what medicine's about, unfortunately. You hear these Obamacares, you hear all these different things. It's about cutting the cost to the insurance company and to the government, and this is one way that's going to do it. And eventually, I think if it's taken on quick enough here, it will eventually be covered by insurance at a lower rate, but at a higher volume.
All right.
And one thing that's important, it's great to talk about these pro athletes, and this is a sports show, and I understand all that. It's the average Joe that really is going to benefit from this. The guy who owns his own landscaping company, the guy who owns his own electrical company, he doesn't have time to go and get surgery and be off work for 3 to 4 weeks because he's handicapped due to the surgery. If you give these guys an option to go ahead and get this treatment done, not only can they go back to work, but they're going to start that healing process, and they're going to let their buddies on their softball league know, they're going to let their buddies on the dart league, and it all tends to snowball for the physician to really, you've got a niche group of people in a small community that can really benefit from this, and that's where I truly see this going.
Who are the doctors who are most likely to offer the PRP?
For sports-related injuries, obviously, it's the orthopedic physicians, non-surgical orthopedic docs, podiatrists, patients, the physicians that see the patients with the common aches and pains, if you need surgery, obviously you need surgery. I mean, if it's a completely ruptured tendon or ligament, we got to repair that. But there's partial tendons and ligament injuries that, you know, you're just kind of limping on with conservative treatments and you're bracing it and rehabbing it and this and that. If we can go ahead and get that accelerated healing to occur quicker, and the person and the patient is able to get back to the...
One last question before we leave, Steve. What about backs? I mean, you've had all the disc space, all those injuries. I mean, I don't know if it's appropriate, but if it's appropriate, that's a huge area for people with lower back and cervical neck injuries. Has that been shown to help those the discs out as well?
They've done some preliminary studies at the Hospital for Special Surgery in New York City, where they're able to show that the introduction of PRP into the disc space of the back has been beneficial. You know, I see SI joint injections and facet injections being done much more routinely than we did, say, 4 or 5 years ago. And the response from the patients has been very positive. So I see that coming down the pipeline, and I see that coming down the pipeline aggressively.
Well,
We need some more studies.
All right,
That's
let's do it. Let's get some studies going.
ESPN
South Florida
will
foot and
sponsor.
ankle. Let's get some, I'll be a candidate.
Okay.
My heel's been bothering me. Let's do it.
Okay.
Should have done it live here on the show. All right, well, Steve, really appreciate it. You can learn a lot more about Steve White, Accelerated Biologics. Great, I'm really solid with that word. Accelerated Biologics. You can go online and read a lot more about that. And keep in mind what he said about not all PRP is created equal. Be sure to ask your doctor. Be sure to do your research. It sounds like a really hot, emerging technology. That's something we're going to be hearing about for years to come, John. So I feel a little bit ahead of the curve in the education that you helped give us today.
Well, today was great. I mean, today we've talked to the doctors who talk about this all the time. And we sit here like PRP, but now we have a little better understanding of it. Hopefully the community has a better understanding of what we're doing. And I think in the next 3 or 4 years, it's going to be big. This is what you are going to be treated with to hopefully avoid being in a cast for 4 to 6 weeks, hopefully avoid, going to therapy for 8 weeks, those types of things.
Well, you could say you heard it here first.
Absolutely.
On the injury report. Thanks again, Steve.
My pleasure.
Really interesting topic today. And we look forward to next month, John. Always a
Thank you.
fun one.
Thank you very much. It was great.
All right, there's been another injury report for Steve White, John Cutler, Steve Politziner. Hope you enjoyed this month's episode, and we'll see you next month at ESPNWestPalm.com.